Welcome to The Explainer. We're all about breaking down really complex topics into stories that are clear and, well, powerful.
So let's just jump right in. How can something as common as getting sick completely push a family into poverty? It sounds extreme, right? But it's a question a new economic study on Nigeria decided to tackle head-on. And what they found, well, it has huge implications for millions of people all over the world. We're talking about how a single health crisis can spiral into a lifelong financial catastrophe.
So it all kicks off with something researchers call a health shock. A serious illness or accident that suddenly throws a family into a financial crisis. And listen, this isn't just about paying the doctor's bills. Not at all. It's about this cascade of absolutely devastating choices that families have to make when there's no safety net to catch them.
So to get by, families have to turn to what economists call detrimental coping strategies. And I know that sounds like a dry academic term, but these are gut-wrenching, life-altering decisions. I mean, can you imagine having to sell the very tools you need to make a living, or pulling your kids out of school, basically slamming the door on their future? These aren't just temporary fixes. They're choices that can trap a family in a cycle of debt and hardship for generations to come.
Okay, now this is where the study gets really interesting. It doesn't just take a snapshot of who's poor today. Instead, it looks at who is in danger of becoming poor tomorrow. And that, right there, is a critical distinction. It completely changes how you look at the whole problem.
And this difference is absolutely crucial. Think of it this way. Poverty is like a photo of your bank account today, but vulnerability to poverty, that's like the weather forecast for the next year. It's a forward-looking measure of risk. It doesn't just capture the people who are already poor, it also includes all those families who might look okay on the surface but are actually living on a financial knife's edge, just one emergency away from total disaster.
And when you see the numbers, the scale of this problem is just staggering. In Nigeria, the study found that 59.2%, let that sink in, nearly 60% of households are vulnerable to poverty. That means almost 6 out of every 10 families are living with this constant, nagging risk that just one bad break could push them right over the edge. Okay, so how do you actually measure the impact of getting sick? You can't just compare a family that had an illness to one that didn't, right? Because they could be different in a million other ways. So the researchers had to get clever. They used a really smart statistical method to create a truly fair comparison. What they did, essentially, was create statistical twins. They found 2 households that were nearly identical in every single way that matters. Their size, where they lived, how much wealth they had, you name it. The only key difference was that one family had recently dealt with an illness and the other hadn't. By doing this, they could isolate the exact effect of that health shock, stripping away all the other noise. And here's the bottom line. After all that incredibly careful work, the result was crystal clear. Just one health shock makes a household 5.4 percentage points more likely to become vulnerable to poverty. That's not a guess, it's a direct, measurable push towards financial disaster. But wait, that 5.4%, it doesn't even tell the whole story. Not by a long shot. Because it turns out, the impact of getting sick depends enormously on one simple thing: where you live. The researchers uncovered this huge gap between what happens in rural areas versus urban areas. What the data shows is this stark rural health penalty. For families in rural areas, a health shock jacked up their vulnerability by a whopping 6.9%. But for urban families, the effect was so small it was barely even measurable. It's clear the risk is not spread out evenly at all. So why the huge difference? Well, it seems rural households face this kind of triple threat. First, it's just harder and more expensive for them to get medical care. Second, there are usually fewer job options. And third, and this is a big one, their income is often tied directly to physical labor, like farming. If you can't work, the money just stops, instantly.
Okay, this brings up the obvious question, right? What about health insurance? Isn't that supposed to be the safety net that stops all this from happening? Well, in theory, yeah, but the reality on the ground, it's a whole lot messier.
The first clue is a single shocking number, just 2.2%. That's the percentage of households in the study that had any kind of health insurance. When coverage is that incredibly low, insurance just isn't part of the equation for almost everyone.
And the researchers say it themselves. Because so few people are covered, the study couldn't find any proof that insurance was actually protecting people on a large scale. I mean, it makes sense, right? For a safety net to work, it has to actually be there to catch you when you fall. A tiny net isn't going to do much good.
So let's wrap this up. What are the big takeaways here?
First, getting sick isn't just something that happens to poor people. It's a major reason people become poor in the first place. Second, this risk is way, way higher for families in rural areas. And third, the systems we have in place right now, like health insurance, they're not reaching enough people to really move the needle.
Ultimately, this research draws a razor-sharp line, connecting a nation's health to its economic stability. And it leaves us with a really critical question, not just for Nigeria, but for policymakers everywhere. If a nation's health truly is its wealth, how do we start building a future where getting sick doesn't mean a financial death sentence,